Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Benign musculoskeletal system, tumors, that is the Enneking's system. So under this, we look at the latent. So what does the latent include? So a latent, it includes, what is the location? There is infrascapular, that is intrascapular, is under the latent. Next, when you look at the CF, that is the clinical findings, it is going to be often, it is the incidental findings. It is incidental findings. Next, what about the X-rays? So under the X-rays, the latent, it is nothing but a well-defined margin with thick rim of the reactive bone. So it is nothing but a well-defined margin. So it's a well-defined margin with a thick rim of reactive bone. The thick rim, it has a thick rim of the reactive bone, and this bone is on the X-ray, and there is no cortical destruction or expansion. There is no cortical destruction or the expansion. Now let's look at the examples. The examples of the latent variety. So under the latent variety, what is the example? The example is, it is a non-ossifying fibroma. Non-ossifying fibroma. Then we look at the active variety. Under active variety, the location is infrascapular. Next is the clinical findings. So under the clinical findings, there is symptomatic. So symptomatic is that it may present with a pathological fracture. So there can be the pathological fracture. Next is upon X-rays. Next is upon X-rays, what we have? There's a well-defined margin and a thin rim of reactive bone. There's a well-defined margin as well as a thin rim of reactive bone on X-ray. Then comes a narrow zone of activity. So this is limited bone destruction. This is nothing but a limited bone destruction. Now let's look at the examples. The example is that it includes the aneurysmal bone cyst. Next, we look at the aggressive variety. So there are three varieties. One is the latent, one is the active, and one is the aggressive. Now let's look at the aggressive variety. So in terms of the aggressive variety, it is nothing but location is extrascapular. It is extra capsular. And what is the clinical finding? The clinical finding is it is symptomatic. And what are the X-ray features? The X-ray features is that there is a bone destruction and of the soft tissue. There is bone destruction as well as the soft tissue extension. There is metastasis and it may be present in 5% of the patient. So there is metastasis. So this metastasis is present in about 5% of the patients. Next we look at the examples. In the examples there is a giant cell tumors. So let's just focus on the examples. In latent it was non-ossifying fibroma, in active it is aneurysmal bone cyst, and in aggressive it is a giant cell tumors. To learn and grow daily like this, please do subscribe.